Good afternoon, everyone, and thank you so much for joining us today for our TMLT webinar series. Our topic today is finding reliable IT support. My name is Cassie Toerner, and I am a Senior Risk Management Representative in our Risk Management Department, and I also am a member of our Cyber Consulting team. I'm joined today by Cathy Bryant. Cathy, would you like to introduce yourself?
Thanks, Cassie. Yes, I'm Cathy Bryant. I'm the manager of TMLT's Cyber Consulting Services, new name for the department that was previously known as Product Development and Consulting Services. We are excited to have everyone with us and bring a topic that we hope is very interesting to all of you.
Great. Thank you, Cathy. And before we get started, just a couple of housekeeping items. If you have a question, please feel free to use the very bottom pod to type your question in there. Also, the handouts are available today in the slide file box over on your left-hand side. If you click on there and highlight, you can download today's slides. There's also another resource there called a annual questionnaire that you can download, and we'll reference that later on in the presentation. As Cathy mentioned, we hope that you find this helpful. It looked like from our poll today, Cathy, that the majority of folks have someone on their team that's doing some IT functions, but they're not, that's not their primary role. So as we go through today, our objectives are to explain the importance of selecting an IT partner to support your practice, understand the difference between IT support MSP and MSSP, and identify ways to evaluate IT support providers. So when selecting a partner, we know that your medical practices are focused on providing the highest levels of care to your patients. And so selecting a partner is really important. Ultimately, the practice is responsible for maintaining compliance and meeting regulatory requirements. So again, it's really vital that we pick a partner to achieve that mission. Your IT partner should offer you full transparency and business continuity commitments from a technological standpoint to the practice. So when we say that, what we mean is they can offer you an onboarding audit to look at all the components technology-wise in your medical practice and give you recommendations based upon what they are seeing and offer to you ways to stay in compliance and also to avoid disaster, regardless of what that disaster may be. Also, it's not unreasonable to ask if they have experience with medical practices and HIPAA specifically as a IT partner, because we all know that HIPAA is different and medical practice function differently than other areas or industries. So that's something that you can definitely ask. And also, Cathy and I were talking about this earlier. If you ever feel uncomfortable or you feel like your needs aren't being met or you don't have confidence or there's some doubt or poor communication with your IT provider, you can always change and look and vet for another provider. So as we're talking about disasters, we all know that the primary type of disaster is our breaches. So we include here for you HHS's most recent data that they've put forth on types of breaches that have occurred. And our 2020 takeaways are this past year, there has been a 25% year-over-year increase in healthcare data breaches. They've doubled since 2014. And in 2020, there were 642 healthcare data breaches, which means there was a little bit over one per day of over 500 records being reported. So in total, 2020 saw over 29 million healthcare data records breached. And if you take a look at the chart there, it's a comparison of 2009 through February of 2021. And then the chart on the right is just January 2021 through February 2021. And you can see the increase in hacking incidents that's gone up significantly over time. And overall, since 2009, we've seen over 78 million records be breached in a healthcare data incident.
So one of the important concepts that we would like you to take away is that there are different levels of service that are offered by different types of delivery models when it comes to IT service providers. The first is called time and materials. was actually one of the most common ones in the poll, as we saw earlier. Another name for this type of service delivery model is Breakfix. This is literally where when something breaks, you have a group on standby that you call and they come in to fix the problem. The other type of delivery model is fixed fee. This basically means that you have a contract with a provider, an IT provider, to provide services on a flat fee basis or a flat rate basis. This is often a managed service provider or a managed security service provider, and we'll dive into those just a moment. They basically act as your IT department. Their principal approach is to keep you up and running all the time because in the long run, that model is least costly to the IT provider. So let's take a look a little deeper at the break fix or the time and materials model. This is again where you have a problem, you pick up the phone or send an email to the person you have an arrangement with and say, something broke, please come fix it. Often, the advantage that practices see to this service model is that it offers the least upfront cost to the practice. You're not paying out on a monthly basis, you're only paying when something occurs that needs attention. However, there are some possible issues. The biggest is that no one, as an IT professional, is really responsible for maintaining the overall network and systems that you use on a daily basis because they're just coming in to fix something when it breaks. This may actually lead to poor maintenance of your systems. You could have poor performance, and you could also be opening yourself up to vulnerabilities that hackers can actually take advantage of. Sometimes there's even a conflict of interest because if you have a problem and you call the vendor to come fix it and they only fix the immediate problem and they're not looking for the bigger root cause of the issue, it may be that you call them back next month because another PC has the same problem that they just fixed this month. And they're not taking that global overall view of what's in the best interest of the practice necessarily. And this can often lead to further billing on their behalf because they bill you every time they come out and fix something. Probably the more common uh, advanced or flat fee service that we are seeing are the managed service providers. Managed service providers basically come in or come under contract and they function as your IT department to a certain extent. They're there to deliver services, whether that's networking, applications, infrastructure, security support, like with uh, maintaining your antivirus, anti-malware software up to date. Sometimes they may be actually hosting your data in their data center or contracting with a third-party data center on your behalf. Traditionally, they have mainly looked at infrastructure and devices. However, we are seeing this model merge into the continuous monitoring, regular management and maintenance, as well as support for your systems. The highest level of flat fee uh, IT support is Managed Security Service Provider, or MSSP. When you add that extra S, of course, that adds an additional cost typically. Typically, the managed security service provider is providing monitoring management of your system devices as well as your entire network. Commonly, they monitor and maintain things like your firewall, intrusion detection, your VPN, vulnerability scanning, antiviral antivirus services, other patch management services throughout your organization. Typically, this level of provider is available on a 24-hour, 7-day-a-week basis to keep your system running optimally. And so you can imagine that with this higher level of service, the expanded service of 24 hours a day, 7 days a week, you will be paying a higher cost.
So we know that this can maybe be a little bit overwhelming at times, trying to figure out how should I choose a vendor, and what considerations should I keep in mind whenever looking at a vendor. So we hope for this next portion will help you to have some criteria as you walk through to select a vendor. And the goal of investing in an MSP, as Cathy just explained the differences between those, is to allow you to focus on the quality of your practice, growing your practice, and most importantly, patient care. While the MSP is working to help you with the pre-configured and highly effective tools to protect the patient data and to make your operations efficient from a technology standpoint. So choosing an IT provider, what should they know about HIPAA? Cathy and I sometimes will chuckle that if it's not spelled correctly, HIPAA, that might be your first tip. So here are a couple of things that we would recommend: that they will sign your HIPAA Business Associate Agreement. Are they willing to do that? Are they conducting a HIPAA security risk assessment for their practice or for their company and organization? Do they have a HIPAA privacy and security officer? And are they doing annual work training with their workforce? These are questions that you can ask any vendor that you're looking at, and they should be able to provide you responses to these questions. So when you get through these and you're looking to move towards a contract and what those contracts should involve, um, here's what we would recommend that you look for whenever you're looking at contracts. First thing is guaranteed response times. We all know that in healthcare that fast response times are very critical. So when you're hiring in an MSP, you can always ask them what are their response times. And generally we would recommend that they guarantee you a response time frame, and also that they're available for support 24/7, because you know those calls are going to come up or something's going to happen at the most inconvenient hour. That they have proactive security. So for this, that they are aligning with your medical practice for what is required by HIPAA. As your practice grows, obviously your risks are going to grow, and the ideal managed service provider will be able to invest in your practice, keeping up to date on security trends, and implementing those best practices for you and your group. They should be able to adapt and adjust to help you make sure that you're protecting the patient's data appropriately and improve your performance. The MSP or support that you choose will have engineers that are being trained and educated to understand how best to serve you. They should be conducting on-site periodic visits with you guys to look for ways to improve your business operations, lower your cost, improve your efficiencies, resolve any problems or discuss any problems that are arising that you've noticed. And hopefully they should help you utilize your resources, your technology, to be the most profitable and efficient that you can be. Strategic consulting, as we all know, now with the digital revolution and more technology, that new tools are on the rise. An ideal provider will have a strategic business consultant available to you that's versed in business operations as well as in technology. The consultant should be able to work with you and your leadership team to offer solutions. Oftentimes, organizations understand their business needs very well, but are unsure how to translate those into a technology issue or a concern. So having a consultant can help facilitate those business operational needs into a technical solution for you. And also education and adoption. Employees are your greatest asset, but also your greatest risk and vulnerability. So ensuring that they're trained and have the access and the tools that they need is very valuable. And a provider, an MSP provider, an IT vendor support partner can provide those training and that valuable tool to help your team be confident with IT functions and to have confidence in the technology that you all have set up. So once you have gone through those types of things when you're going through your contract process with vetting a vendor, if you select them, you can ask them for proof of cyber insurance that includes technology errors and omissions. And you can also ask, will you name us on your cyber insurance policy as an additional insured on a primary non-contributory basis? So in the end, who is liable if a breach is caused by a vendor that you've chosen? This is a quote from an attorney, and he basically is saying both the medical practice and the business associate can be liable in a data breach. No longer is it just the covered entity or the healthcare practice, but from a financial perspective, both share the risk. So business associates obligations, I'm going to just touch on business associates a very high level, Kathy and I will, but we're going to leave the content of business associates and their role for our monthly webinar next month. We're actually going to be joined by Adrian Sinishin, who is an attorney, and he will go much deeper into who is a BAA, what is a business associate, I'm sorry, what is a BAA and who is a business associate, the importance of your business associate agreements, enforceability, and really dive much deeper into that than we will today. But just to give you the basics of a business associate obligation here, they should be able to execute and comply with the terms of the business associate agreement that you have in place, and it must contain terms required by HIPAA, and then also comply with the security rule. We mentioned this earlier, asking if they have a security officer. Have they done a risk assessment? Have they implemented safeguards? Do they have subcontractors that they're working with that would impact your practice as well? Do they have written policies and procedures that address HIPAA privacy and security rules? Are they training their personnel, education? And do they comply with minimum standard necessary rules? And do they report breaches of uncovered PHI to the covered entity? Sometimes this is difficult for business associates and some subcontractors to comply with, but it is definitely something to keep in mind as you're selecting your vendor and establishing a business associate relationship with them. So does my BAA protect me? Signing a HIPAA business associate agreement is required, but it does not always guarantee that you're protected from a business associate related breach. So it's really important to ensure that the business associates that you're working with are protecting PHI. Due diligence when it's possible. You can ask questions. The reference that we have, the resource rather, that's BA annual questionnaire, is a list of questions and an outline that you can use to go through when you're vetting a vendor, questions that you can ask. As we've mentioned, have you had a risk assessment? How do you do audit logs? How are you reporting back to your covered entity any potential concerns? What's your controlled access like? How are you training your employees and on HIPAA? And then also you can use that for each vendor that you want to choose and asking questions. Questions won't necessarily stop the breach, but if the BA answers no to your questions, then that can give you a pause or a concern, and then you can continue to evaluate other vendors as you're moving forward. So Kathy, what if the IT vendor's actions do actually cause a breach? What are we to do?
Well, we know that often healthcare industry in general is a target for hackers and cyber criminals. But we also know that the hackers and cyber criminals have figured out that other people, such as our business associates, IT vendors as an example, have access to your actual networks. I think we all remember the now infamous Target breach from a few years ago, where their credit card payment system was actually breached. The way that the cyber criminals actually got access to the credit card payment system was by going through, of all things, a heating and air conditioning vendor who had access to the network to do remote work, adjust temperatures, and do other kinds of remote maintenance. But because of their lax security on their side, their network and passwords were breached. That left an open door into Target's network and just almost a complete boulevard into their payment card information processing system. I think that's a real good example that we can all think about as to everyone that we give access to the network needs to have good security controls. But that was a non-healthcare example. Um, we know that we see many different kinds of examples of problems that arise for providers, for practices, when an IT provider's action or failure to act responsibly in the best interest of your practice has occurred. Unfortunately, there's no such thing as IT malpractice, because I've had many practices want to sue their IT vendor for malpractice, but that's really not anything that is defined in the law. We know that you must have an IT vendor that you can trust, because first of all, that's their primary job. And second of all, as Cassie mentioned, your primary job is to take care of your patients, but you must also protect your data. So no matter how much you trust your IT vendor, we encourage you to adopt a trust but verify position. No matter how much you want to take the word of your vendor, no matter how long you've had a relationship with them, it may not be sufficient just to believe that they have done something correctly just because they tell you that they have. There have been many cases of devastating consequences for practices when a practice has had complete confidence in their IT vendor and not actually done the trust but verify step. A couple of examples are backup systems that are not set up correctly. Then when a situation occurs and data retrieval from a backup system is required, several times we have worked with practices that the IT vendor set that up incorrectly, and therefore the actual data was not available. We always encourage you to do a test restore from backup every year at a minimum, because you want to have proof that that backup system is working. Recently, we've had a number of clients that are dealing with breaches and OCR investigations, the HIPAA police, as I jokingly call them, from firewall ports that have been left open for the convenience of a vendor. For a long time, this practice has been relatively common, where they leave kind of a little back door open to make it easy for a vendor to come in and service hardware or software for a practice without having to come on site. It's really important that vulnerability scanning is done on a regular basis to look for those open ports, because if a scan can identify an open port, so can the cyber criminals. They're basically using the same technology that the proactive vulnerability scans use to look for those open ports and other vulnerabilities. Probably one of the most common issues that we do see as it relates to IT vendors is failure to maintain software patches. As vulnerabilities become known and the different software vendors issue software updates, are called patches, that limit the cyber criminals' access to your network or through that software. That can be anywhere, anything from your antivirus, anti-malware. It can be Microsoft Office and all the products that they have. It can be all the different products that you get those annoying little pop-ups that an update is available. Do you want to do it now? Or do you just hit that minimize but if your IT vendor is supposed to be maintaining those and they aren't doing that, then you certainly may be setting yourself up for a failure point. It's very common for your IT provider, especially when you get to the MSP and the MSSP level, to provide you with a monthly report of what they've actually done. How many of their PCs, or how many of your PCs have they verified that your anti-malware, antivirus software is up to date on? That's just one example. How many failed login attempts have there been at the network level and potentially even at software levels? So these are all things that you need to be aware of, because as Cassie pointed out, there is liability for a breach from both the covered entity standpoint and the vendor standpoint. We know that there are consequences if a vendor or your business associates cause a breach. We've talked about these many times before. Anytime you have a breach, that it's going to take time away from your patient care. You're going to be responding to questions as well as investigations. Those can be at both the federal and state level. There can be additional expenses that cause financial burdens, either for things you have to pay for that you did not expect to pay for, or loss of revenue, and harm to your reputation. Surveys are suggesting that up to 30% of patients state they would leave a practice if it experienced a breach that involved their data. And of course, there are fines and penalties. We certainly hope that you never get to the point that you're at that point, but these are all realities. And I know of one example where a practice, clearly the breach was caused by an error on the part of the business associate. And what happened with that business associate? They literally closed their doors and went out of business. They didn't have cyber insurance. They didn't have technology errors and omissions. And as the obvious point of failure became the business associate, they basically closed up shop and moved on, and there was no recourse for the covered entity to actually try to involve the business associate in the defense of their OCR investigation. Here's your opportunity to ask us questions. I don't see any currently in the question and answer pod, but please continue to think about questions and feel free to enter those. Certainly, if you come up with questions after the presentation has concluded, we always welcome your questions at consulting@tmlt.org, and we're happy to answer those questions. We are offering today's program as a half-hour CME credit. if you would be so kind as to fill out the evaluation form, the CME evaluation form. We will open that in your browser and it will be available for you in just a moment. Cassie, any closing remarks, as I'm not seeing any questions?
No, Kathy, thank you so much. I think just a reminder for next month to join us again, kind of an extension of this conversation about business associates with our attorney Adrian Sinishin, who will be joining us. Hopefully you can join in for that as well.
Yes, be watching for information on how to register for that webinar next month. That will be a full hour webinar, and we believe that the information that Adrian is putting together is going to be extremely valuable for everyone. So uh, tell your friends and colleagues that to be expecting that presentation and that webinar announcement very soon. Would just want to thank you again for attending today's webinar, and we look forward to seeing you next month. I'll be launching the CME evaluation in your browser now, and we will see you next month.